So I am super excited to chat with Dr. Meg Mill as we will be talking about histamine and tying it into thyroid health and a lot to talk about when it comes to histamine. So let me dive into Dr. Meg's impressive bio here and then we'll start our conversation. So, Dr. Meg Mill is a PharmD and certified functional medicine practitioner with over 2 decades of clinical experience. She's also a best-selling author, podcast host, summit host, and sought-after corporate wellness speaker. Her virtual functional medicine practice has transformed the lives of hundreds of clients worldwide by connecting the dots between their diverse, unexplained, and often overlooked health struggles such as migraines, gut issues, chronic fatigue, skin reactions, anxiety, or allergies. She uses her EAT method to uncover and resolve the underlying connections, whether it's histamine intolerance, hormone imbalances, gut dysfunction, or MCAS, mast cell activation syndrome. And welcome, Dr. Meg.
Hi, thank you so much for having me.
Yeah, it is a pleasure to have this conversation talking about histamine. So many people have histamine imbalances, and many of these people don't know they have histamine imbalances. But let's start off. Let's first dive a little bit more into your background. So, how did you start helping people with histamine intolerance as well as mast cell activation syndrome?
Yes, well, I actually have have it myself, and I didn't realize it for so many years. I mean, I was the kid with getting allergy shots with tons of allergy. I remember my parents actually redid a dresser for my room, like had it painted, and I couldn't even keep my clothes in the dresser after it was painted because it would make me so sick. And I would say, like, I can't, my clothes make me sick. And I can't, my mom was like, why? What's wrong with your clothes? And there's all these like clues for people over time, I think, that we'll get into why that's happening. But what I started to find was that this histamine issues, mast cell activation, they're growing more and more, and they're connecting a lot of different symptoms. So what, like I'm saying, I was someone who had allergies. I felt I was highly reactive. Then I started having GI issues where I couldn't even eat anything. I was having so much stomach pain. So I started jumping around from different gastroenterologist to gastroenterologist and getting told that I was fine, that I was a picture of health. And then I started getting anxiety, which eventually led into insomnia, and all of these things that started happening and building on each other that seemed to me were unrelated, but they all have this common link, which is histamine. And so sometimes when you're looking at it through the histamine lens, you start to connect all of these dots and think, okay, wait, that doesn't seem like my anxiety and my allergies and my gut issues, and they don't all seem related. But when we're looking at it from that point, if we can get the histamine to be lower to get it under control, a lot of things will clear up. So I was having a lot of my own personal health issues. And then I also was not getting any answers and being told that I was fine. And here I'm in the health space and I can't get answers for myself, which led me to functional medicine. So I actually made a career change, went back and got certified in functional medicine and opened a functional medicine practice. And now I help people all over the world really get to the root of their mystery health conditions and looking really at the connections of all of these different symptoms and how your body really builds on the connections, and we can just unwind it to get you feeling a lot better.
All right, wonderful. Yeah, it can histamine issues can definitely be complex, and I think while some people, it's safe to say, some people watching this, listen to this, are familiar with histamine. There are some people who aren't familiar with histamine. So that's going to be my next question for those
Yes.
who are like, "What's histamine? Can you explain what it is?" How, and and we'll go deeper and a little bit. We're not going to get too much into mast cell activation syndrome, or we could. It depends on you, actually, but
Yeah,
definitely
well, we
want
can.
them to at least know the
Yeah.
basics of histamine and
Yeah.
histamine metabolism.
Yeah. So histamine, I feel like, is the new cortisol. It's like everyone, when you think of cortisol, you think of bad. And when you think of histamine, you think of bad, but they actually do have purpose in your body. So histamine is what we call a biogenic amine. And when your immune system detects an allergen or an invader, histamine is released primarily from your mast cells or your basophils as part of your immune response. So in your immune system, we have two different systems. We have your innate immune system and your adaptive immune system. So the mast cells are part of this innate immune system. So they're ready to go. Anything that comes in, they're ready to fight. They're not selective. They're like, let's get this. And so one of the things they release is histamine in order to do things like increase permeability of the blood vessels, which allow immune cells to actually reach the area more quickly. So histamine helps with immune defense. It helps with regulating your gastric acid secretion to actually break down food and aid in digestion. It affects your neurotransmitters, and it can affect serotonin and norepinephrine, acetylcholine. So it can be involved in your wakefulness, your alertness, your cognitive function, your mood. It's a part of the allergic response. That's what most of us really think of at first when we think of histamine. It also can cause bronchoconstriction because it actually constricts your airways to prevent harmful airborne substances to enter too deep into the lungs. And it actually also creates an inflammatory process. So it actually creates inflammation. It recruits immune cells to the sites of infection or injury through this increased vascular permeability and blood flow to create this inflammatory response. However, when it's excessive or not regulated, it can lead to chronic inflammation. And that's when we start to get a lot of these symptoms and problems.
Yeah, I'm glad you mentioned in excess because histamine by itself isn't a bad thing. I mean, it's important. We need histamine.
Mhm.
And I mean, just like inflammation by itself is not bad, it's when it becomes excessive and chronic, that inflammatory process. So I'm glad you mentioned that. And yeah, so let's talk about more about histamine, especially like the metabolism. There's different enzymes, diamine oxidase, and I'll let you take over because again, you are
Yeah.
the histamine expert.
Yeah. So I like to think of this. Actually, let's use a bucket analogy. So think of your body like a bucket with holes in the bottom of the bucket. And so you're filling it up, it's draining. You're filling it up, it's draining. And we keep doing that, and everything's fine. You feel good and you're moving through life. But when we start to have these symptoms of histamine intolerance, we start to have one of two things or both things happen. So we're either pouring too much water into that bucket and it's overflowing, or we plug the holes in the bottom of the bucket, or both. So when we plug the holes, we spill up too much. When we fill too much of the bucket, we fill too much. And then when we get this overflow, let's say, that's when we start to have all our symptoms. And so we'll start with talking about what plugs the holes. So you break down histamine by two different pathways in the body. One is diamine oxidase, which you mentioned, and the other one is histamine and methyltransferase. So the diamine oxidase is the main enzyme responsible for breaking down histamine from foods in our intestinal tract. And we'll get later into some of these histamine producing foods that are often healthy foods. And so that can be really confusing sometimes because things that you think you're eating on purpose for certain purposes to help your body can also be high in histamine and create some of these problems. But we want to look at some of the other reasons that diamine oxidase can become compromised. So, first of all, people can just have genetic variations. I am one of those people. I've told you, I had some of these symptoms forever. Now, generally, they build because even if you have the genetic variations, we'll get into, the gut health can be a huge role. So, if everything's functioning properly, we can usually overcome some of the genetic variants, but you can have genetic predisposition to not process histamine as well. The main thing we see are imbalances in your microbiome. So we need to have certain gut bacteria that can help us break down the histamine. And then we have bacteria that actually inhibit the DAO. So we can have histamine producing bacteria, we can have mast cell activating bacteria, and we can also have things start to happen that compromise this enzyme function. So once we have compromised enzyme function, then we can't break down histamine very well. So everyone pretty much knows about lactose, and that there are certain people with lactose intolerance. And when you have lactose intolerance, you can't eat dairy because you have problems breaking it down. And it's a very similar enzymatic reaction. When we're eating histamine foods, we need the diamine oxidase to really break down those foods so that they're not affecting us. We can also see that once we start to get intestinal permeability or leaky gut, we can start to also get chronic inflammation, and this inflammatory response can also downregulate the production of diamine oxidase, so the body can shift more towards resources for managing inflammation, and then it can further exacerbate histamine related issues. So we're seeing some of those kind of things happen. We can also see certain nutrient deficiencies. We know that certain nutrients are required to make diamine oxidase. So things like vitamin B6, copper, and vitamin C can also be a problem. And I know I keep coming back to the gut, but sometimes when we can't, even if we're eating all those nutrients and we can't digest and absorb them, we may not really be getting the full effects of those. So we're really looking at all of these things together to, look at how well are you really breaking down histamine. Another one that might be surprising to you is actually fluctuations in hormones. So estrogen can cause the mast cells to release histamine. Estrogen can also influence diamine oxidase activity. So higher levels of estrogen can lead to a reduced diamine oxidase activity, and progesterone actually helps increase diamine oxidase. So when we start to become estrogen dominant, we often see when we're having high estrogen to progesterone, we can also see hormones creating an imbalance here that can affect it. So that can play a role. So that's sort of the one pathway. And then we have another pathway, which is histamine N methyltransferase. So you've probably heard about methylation at this point. Everyone's talking about that now. It's good that people are talking about it. So we're starting to see, that we need methylated B vitamins, that we need to be able to methylate in order to break down histamine. So histamine is methylated into histamine N methyltransferase, and where it's actually goes through this methylation process and is excreted in the kidney. So one thing that I just want to clarify this, because a lot of people are talking about MTHFR. A lot of people are talking about methylated B vitamins, which is great. But that is not the only thing that's affected in this pathway. So sometimes we actually need to look further down the pathway. We can also see an MAO variant, monoamine oxidase, sometimes can affect this pathway. So, you might need something like a riboflavin, a B1 or a B2 or certain things. So you can push some methylated B vitamins. And if you feel worse, it might be because you have blocks further down that pathway. So that's just something to keep in mind. But we also need, certain vitamins for nutrients for that. Like we said, we mentioned folate, B12, B6. And so different nutrient deficiencies here can play a role. Sometimes we see poor liver function affecting the methylation pathway, some different drugs. So we just want to make sure that we really have those pathways open.
All right. Well,
That's a lot of information. I'm
yeah, I was gonna
sorry.
say no, that's good. I'm glad you shared that. So I'm gonna kind of summarize. So again, there are two main enzymes that break down histamine. So DAO, diamine oxidase, that's the main one, and then there's HNMT, which is the other enzyme that could help with that. And then there are different factors that can influence these enzymes. So you mentioned the importance of the gut microbiome, of course, genetics. And when we talk about genetics, it's not just MTHFR. There could, well, I know with HNMT you mentioned the methylation, so that has nothing to do with DAO maybe, but HNMT methylation, but MAO you mentioned. One thing actually related to that also, how about COMT? Because you also mentioned that COMT is involved in methylation, but then you mentioned that, and again, this I'm maybe going down a rabbit hole here, but estrogen you mentioned can inhibit oxidase, but then the COMT also plays a role in that
And
in estrogen metabolism as well. So if someone has a genetic variation in the COMT enzyme, can that also affect the breakdown of histamine at all? Or
it can. And a lot of these pathways, like we're seeing, are interconnected.
Mhm.
So, I think that's one of the main points of functional medicine, right? That it's so hard, when you're talking about something, you're looking kind of at this one thing, but I'm always telling people, well, this relates to that, and then this connected here. And they're all connected to each other in various ways. And so that's why when we look at this, we're looking at from a whole person perspective, and we're looking at how each one of these pieces, each one of your lifestyle, your genetic factors, all of your levels are playing a role into what's going on in a unique way for you. And a lot of different things can play into a role when we're looking at some of these pathways and breaking down.
And then what are some of the more common symptoms people will experience when having a histamine intolerance?
Yeah, I think this is a tricky one for people to understand, because when we think of it, like we said, we think of nasal congestion, sneezing, maybe asthma, difficulty breathing, and then you're thinking sort of highly reactive, maybe hives, rashes, things like that. And those all can be, but we can also see headaches and migraines. The people I work with, migraines, I would say a high majority have histamine intolerance. We see fatigue, you can see heart palpitations, dizziness, anxiety, depression, difficulty concentrating, PMS, irregular periods, flushing, joint pain, insomnia. We can see high or low blood pressure. So, as you can see, there's a lot of different symptoms, a lot of digestive difficulty. Like, there's just more and more research with IBS actually, and histamine intolerance, and the effect of mast cells, and how that's really, it's very interesting. So a lot of the IBS symptoms are also coming from histamine issues too, that are playing a part. So I think that's one of the messages I'd love to hit home in this episode, because I think that it's like we're saying, it's more than just allergies. It's all of these things. So when you're having when we're talking about your thyroid, let's say, you could overlap some of these symptoms with thyroid. You can overlap some of these symptoms with, like, a lot of different things, but it's really looking at what lens are you looking at it through, and could histamine be a part of this picture?
Speaking of thyroid, so what are some of the things? What some of the relationships between histamine and thyroid that you're aware of?
Yeah, so thyroid hormones, particularly T4 and T3, can influence the metabolism of histamine. So we do want to make sure that we have proper thyroid function to help maintain balanced histamine levels, and that they can play also a factor in the activity of the diamine oxidase and the histamine and methyltransferase. So, really looking at making sure that your thyroid levels are balanced. And then, really when we're looking at gut, so we're talking about histamine intolerance as gut health. And when we're looking at particular Hashimoto's and thyroid, the leaky gut, the gut health are really critical. So we want to make sure that we're really optimizing our microbiome, that we're looking at what good bacteria we have, what overgrowth we have, and really getting a balanced microbiome in order to optimize this function. We also we're going to talk more a little bit about, I guess, maybe this, and I can bring this up a little bit here too, because the mast cells. So we sometimes can see mast cells present in the thyroid gland, and their activation can affect thyroid function. So we brought up the mast cells, and that the histamine is released from mast cells. Some people can get what's called mast cell activation syndrome. And this is when we're talking about filling the bucket. One of the things that starts to fill that bucket is mast cell activation syndrome, because when we start to have this, our body starts to go into what we call a cell danger response. We start to feel like our cells are under attack. And once we go into this cell danger response, we start to react to everything. So, if someone has mast cell activation syndrome, they are more likely to be someone who, I eat, it's like reacting to a lot of different foods. Sometimes we can react to heat, we can react to smells, we can react to sounds, we can react to EMFs. We start to be more hyper reactive, and our mast cells really almost are getting, let's say, angry, and they're just firing for no reason. So an example I like to use here is if you're smelling a rose and you're touching a stove at the same time, and every time you smell the rose, you touch the stove, and this beautiful smell is associated with this pain. And then the person tells you, okay, smell the rose, but take your finger off the stove. You can smell the rose and still feel that pain because your body is still associating that it's in danger. It's associating that smell of that rose is going to cause you pain, even though that's not there anymore. And that's sort of what starts to happen in mast cell activation syndrome, is that our body's starting to release from these mast cells, even when it's not necessary, when we're not in danger. And sometimes, we're looking at, in that case, we need to look at what is the root cause, what is happening to your body that is causing this excess release of mast cells. And we sometimes also need to work on nervous system rewiring. So really going in and working on bringing our body back into that parasympathetic nervous system to really feel calm, to feel safe, to be able to do some different really exercises to rewire our body and feel safe in where we are. I think I veered off. I'm sorry, because I went from one subject to the next.
Yeah, no, that's okay. So, yeah, that's interesting about the mast cells being in the thyroid gland, and yeah, so not everybody who has a histamine intolerance has mast cell activation syndrome, correct? Like that's
Correct.
more advanced, you would say, like more
Mhm.
like just where, like you kind of explain the mast cells, where you have like an abnormal amount of mast cells and just kind of things go a little bit haywire.
Yes. So, yes, exactly. Not everyone that has histamine intolerance will have mast cell activation syndrome. So, that is more, you can't, a lot of people that have mast cell activation syndrome will have histamine intolerance because one of the chemicals released from the mast cells is histamine. So, you're seeing that issue as a histamine. One of the major symptoms of that are histamine issues, but you can just have simply an inability to break down histamine well, and maybe are putting too much histamine in your body with the inability to break it down well. And all we really need to do is help you break it down, help you rebalance your gut microbiome through the lens of histamine intolerance, really looking at some of these specific things and really making sure those pathways are open, and really we can create balance very easily.
So my next question then, is there a way to differentiate the two? Like when you and again, I don't know if you officially diagnose histamine intolerance by looking at histamine and looking at DAO. I know there's ways to
Mhm.
do that, or if it's more just looking at the whole picture and the symptoms. And I guess similar with mast cell activation syndrome, are there certain markers that you look at on a blood test or elsewhere?
Yeah, so there is a diagnostic criteria for mast cell activation syndrome. So we're looking at tryptase. We're looking, there's you have to do certain testing a few days in a row. There's often urine testing. So there is more diagnostic criteria, but there's many people, it's kind of hard to do. So a lot of people aren't actually always getting the diagnosis. They just can feel the symptoms. With histamine intolerance, we can test histamine levels in the blood. So that is a place to start. But I personally don't find that the end all be all marker, because I see many people with histamine intolerance, histamine issues, that aren't necessarily showing really high blood histamine levels or high diamine oxidase levels in a blood test. But so it's really more, I personally like more of the diagnostic criteria. We do stool tests, so we're really looking at the microbiome and really looking at some of the different factors to see what the person needs. And so, I think that's another frustrating feature of people that have this issue, is that sometimes even the testing isn't showing up as something that's conclusive, and you feel like, I'm having these symptoms. I don't feel well. And everyone's saying, you're fine, you're fine. And it's not so clear. So listen to your body. If you're saying, okay, I do have some of those symptoms. Okay, I do have a cluster of more than one thing, and I want to see what's going on, and I do feel like I'm more reactive, then listen to yourself and start thinking of this, because it's going up and up and up. We're seeing more and more cases. I mean, I think it's becoming more mainstream because more people are really experiencing it than ever before.
Yeah, it's a good point because even if you are able to diagnose histamine intolerance or mast cell activation syndrome, you still need to address the cause of the problem. So you mentioned that you do stool testing. You also mentioned earlier that you do things to balance the parasympathetic nervous system and do some rewiring. So it's great. I mean, people still want to have an answer. Like if they have
Mhm.
type 2 diabetes, insulin resistance, it's nice to actually see that on a blood test. But when it comes to histamine intolerance, they may or may not get the answer. But either way, you want to do things to address the cause. And you mentioned earlier also IBS, and I don't know if this still holds true, but I know at least a few years ago I heard where at least or maybe 70% of IBA or with SIBO, there's an overlap between small
Mhm.
intestinal bacterial overgrowth and IBS. I think that not all cases of SIBO are IBS. Maybe it's like 70%. So I guess there's that overlap then with histamine intolerance and SIBO too. Like I guess the question I'm trying to ask is when you see it, people with SIBO, small intestinal bacterial overgrowth, a lot of those people then do have histamine intolerance, or is that something that you
Yeah.
see in a lot of SIBO patients?
Yes. So yes, and in here there's kind of two different. There's three different ways. So that's a great question, because we'll talk about. So well, first of all, when most of those people, when you start to have SIBO, when you start to have IBS, you have a disruption in the mucosal layer of your gastrointestinal system. That's where diamine oxidase is produced. So when we start to get this imbalance, one, we start to potentially get a compromised function of diamine oxidase. So that's kind of one bucket. Then we also know that there are certain bacteria that are histamine producing. So we have things like certain forms of lactobacillus, Morganella, Pseudomonas, Citrobacter, Klebsiella. We have certain bacteria that can actually be histamine producing and be behind some of these triggers on their own. I'm going to take a side story and just to tell you this one story, because I think it's very interesting. I worked with a man who had been had urticaria, itching so bad for 20 years that he had to take hydroxyzine every day, which is a prescription antihistamine. And once makes you very drowsy. And as soon as it would start to wear off, he would just full body itching, would have to just take another one constantly. He was getting shots. He'd been to so many different doctors. He had no GI symptoms. But I said, I want to do a stool test. And he's like, I have no GI symptoms. There's nothing wrong with my gut. I said, just, bear with me. We're gonna do the stool test. Well, he had really high levels of Morganella, and that's a histamine producing bacteria. We treated the Morganella, and within 3 to 4 weeks, his itching was gone. And I think it's just such a profound story, because it's showing that 20 years of this really severe problem that had nothing to do with his gut health in his mind was really from a histamine issue from some of these microbes. They're very powerful. And I think we sometimes don't really realize that. So I wanted to, just give you some context around some of the things that can be going on that you're not even realizing from the microbes. And then the third bucket is that when we have SIBO, when we have a parasite, when we have H. pylori, when we have some of these invaders, our body is feeling like there's that can be a root cause. Our body's feeling that there's an invader. I have to create an immune response. I have to fight this invader all the time. Well, that's stimulating your immune system. So if you're sensitive in your immune system, you can be releasing more mast cells to degranulate and create more histamine, more mast cell issues. So there's kind of like there's three different ways, and all of them can be playing into this dynamic.
All right, very cool. Thank you for explaining that. And so yeah, so pretty much, I mean, you mentioned gave the example of Morganella, but if you have other imbalances, like again, if you have H. pylori, if you have parasites, Candida overgrowth, maybe even not. We mentioned SIBO, even how about CFOs, small intestinal fungal
Yeah.
overgrowth, also.
Mhm. Yes.
Yeah, and then so when people are aware that they have a histamine intolerance or they suspect they have a histamine intolerance, some people just they eliminate foods higher in histamine, and that could, in some cases, make a big difference in the symptoms. So it's not addressing the cause of the problem, but do you still have people do that while they're addressing the cause of the problem to avoid those foods, to avoid the histamine liberators as well?
Yes. So I think it's a very good tool to use. And I love how you said that because I don't think it's, I think people can get really caught up in the low histamine diet and like the nuances and start to feel like this is just the way I need to live. And so I want to stress that that's really not the end all be all. It's not just, okay, stop eating all histamine foods forever, but it can be a really good resource for you to start. So we want to start looking at different kinds of foods. So we know there are certain foods that are high in histamine, such as cheeses, fermented foods, cured meats, alcohol. And I also do want to, two foods, it's interesting because we're talking a lot about gut health here. If you're looking at a generalized protocol for gut health, fermented foods and bone broth are generally on those protocols because we know they support the microbes and they're good in general, but not for people with histamine intolerance. You just have to be careful that when you're looking at this, you're doing it through the lens that you're looking at it, because that can be also very confusing and you might be actually stimulating some reactivity in yourself. So we also can see histamine liberating foods like strawberries, tomatoes, bananas. We start to see we can have foods that limit diamine oxidase. Tea is a good example of that. Caffeine can block diamine oxidase. And the other interesting component here is that when it comes to this freshness count, so you can actually have issues with histamine from cooked meats. So if you're a meal prepper, you might want to flash freeze. We see a lot of people have issues with leftovers because histamine can grow in cooked meat. So it's one of those things to always make sure that you're eating more fresh foods rather than leftovers or canned products.
Okay. No, that definitely makes sense. So be careful about some of the foods you mentioned, but the bone broth and the fermented foods, you're right. I mean, they're healthy foods, but if someone has a histamine intolerance, it could cause a lot of problems. Definitely from a symptomatic perspective, and also you mentioned also kind of increased inflammatory pathway as well, or the inflammation.
Yes.
Okay. And supplements. So just like food, certain supplements can help, but they're not fix or eliminating certain foods I mentioned can help, but they're not fixing the cause of the problem. Same thing with supplements. They're not necessarily a fix, but there are certain ones like quercetin. There's some companies that have DAO supplements. So what are your thoughts on those, at least on
Yeah,
a
I think they're
temporary
great.
basis?
I think they're great tools. I think, really that we want to calm down the mast cells. We want to reduce the histamine load. So while we're working on the root cause, I do think finding relief is really important. So you can get the DO enzymes, even some I like kind of some combinations of the quercetin with some other like bromelain and other as nettles are good. And there's different things that we can put together that really are effective to bring some of these symptoms down. And they can be very helpful for a lot of people.
All right, wonderful. So gut microbiome, you know, uh, stress, adrenals. You mentioned nutrient deficiencies, having healthy hormones because estrogen dominance can inhibit TAO. Of course, we spoke about you mentioned the thyroid, the importance of having a healthy thyroid. So again, a lot of different factors out there. So I guess just to make it like for those who are looking for some initials, like what would be the first steps people should take, someone who's listening to this and thinking, hey, I'm maybe I have a histamine intolerance. What's like the first thing I should do, or a couple of things if you think there's more than just one thing, at least to get started? Should just be working with a practitioner like yourself? Or are there some things that they can do on their own to get started?
Yeah, well, so I would say start with the low histamine diet. So, and I have a handout that actually really lays that out nicely, because I think a lot of low histamine diets out there maybe are inaccurate or confusing. So, I will give that to you as a resource. You can put that in your show notes. So, if anyone wants to go to that, it's a lot of information on histamine, and then there's food. So you can, follow that. It's nice to have a roadmap in what to do. So they start with a low histamine diet. Be like, hey, I've done that. I'm still having issues, or I don't, want to stay on this low histamine diet forever. I do see sometimes when people just do that alone for too long, they start to react to foods when they start to put them back in. So, really then working with a practitioner to get to the root and really put some of these pieces together. Because if you do, you can see just a dramatic difference in the way you feel.
All right. Well, wonderful, wonderful. And you have a summit coming up. So I want you to, before you talk about the summit, where can people find out about you, like your website, anything else that you want to share? Of course, yeah, I'll include everything like what you just mentioned, the show notes. So yeah, where can people find out about more about you? And then if you could talk about your upcoming summit.
Yeah, absolutely. So, my website is megmill.com, just megmill.com. And I actually do free discovery calls. So if you want to learn more information, I'd love to get on the phone with you and talk through what you're going through. So feel free. There's a place you can book that right on the website. I'm on Instagram over at Dr. Meg Mill, just DrMegmill. I also have a podcast called A Little Bit Healthier, where we talk about all different health topics. So would love to see you over there. And I'm really excited about the summit. It's going to have so much great information. I've spent the last about 8 months working on this and talking, but there's over 50 different experts in this field. So we're going to really talk about histamine intolerance, about mast cell, and about all of the different ways that it can affect you. So it's a free event. It's June 18th through the 24th. And we'll put it's at Dr. Talks is publishing the summit. So you can go to drtalks.com, or I'm sure there'll be a link in the show notes. So just click that link and you can go watch it for free. So just sign up. And like we said, there's about 50 hours of education. So that's a great place to start. We're going to put a lot of these connections together and give you some great tangible tips.
Yeah, yeah, that's going to be awesome. I will definitely, that definitely will be a link in the show notes. So check that out. Check out her website, Dr. Meg's podcast, and again, thank you so much. You shared some great information, just about, of course, histamine intolerance, mast cell activation syndrome, and yeah, real. Also looking forward to your summit as well.
Thank you so much. Thank you for having me.
Yeah, thank you.